Everyone, I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar that we talk about Lyme disease. I see a number of familiar names on my message board tonight, but I also see a number of new ones too. So for those of you that are new, welcome. I hope that you'll learn something tonight that may help with your treatment and help move that forward for you. And for those of you that are back here again, I'm glad to see you keep getting some value about this as well too. So the way that these webinars work, for those of you that are new here, you create them each week with your questions. And the way you can write questions to me is there's a chat box over on the right-hand side of your screen down at the bottom. Write your question in that chat box. I do ask that you do not hit the enter key until the whole thing is complete. If you try to hit the enter key before then, it actually sends multiple questions my direction, and it gets very hard for me to follow, okay? I also request as much as possible, keep your questions brief. If they get to be too long, it's hard for me to read them in a way that people will remember them. And if they're too long, they actually lock my screen up when I try to post them here. So during the webinar, I will actually, for those of you that are participating in the live version, not the recorded version, but the live version, you'll get a chance to see those questions show up on your screen. But if you are in the recorded version, you will not see them. So I am going to read them out loud. And you'll see when we get to do that, how that works. I am creating a recording of tonight's webinar sometime tomorrow morning, usually before about 8:30 a.m. Seattle time, sometime definitely before then. I send that recording out, and that is my plan to try to do the work to get that ready tonight. So it does come out to you tomorrow morning. I have to do some brief video editing to make that happen and write a synopsis of the webinar too. Let me see here. From a business keeping standpoint, so this is our last webinar for this month. I'll be off next week. I do 3 in a row usually, and then I take 1 week off. I'm not going anywhere, but I just want to let you know I won't be doing the webinar next week. The week after that is Labor Day week, and I have not decided yet, or the week before. Yeah, that will be the week of that Labor Day is in, or the week before Labor Day, I should say. And I haven't decided whether I'm going to do one that yet or not. I will make a decision before tomorrow morning. And so I will, in tomorrow morning's email, have a link so you can sign up for the next series whenever I decide that they're going to begin. Okay? All right. And so I look forward to see what you have in store for me tonight. I hope I can answer most of your questions. Usually I can, but every now and then I do get stumped. So I'm wondering what we will get into here. So without any further ado, let's go ahead and get started here. This first question is from JT. Hi, JT. Let's see. Hi, Doc. In regards to Bartonella, in your experience, do BART patients ever have changes in their deep tendon reflexes? 2, and the stria rash that is common, does it look like claw marks, and does it come and go? And 3, can you talk a little bit about shin bone pain and why that happens and what it's like in Bartonella? Thanks for all you do. Okay. All right. So the first thing about the deep tendon reflexes, everyone, that's, we've all had this done. So we go to the doctor, especially when we're kids, and the doctor takes his reflex hammer or her reflex hammer and taps on our knee. That's your deep tendon reflex, okay? And if you happen to have some nerve injury, sometimes the deep tendon reflex will change. Either it will become very weak and you won't have it, or it can become hyperreflexic. It can become really quick and fast, all right? Can that happen in Bartonella? Yes. I don't see it happen. I don't see changes happen in the deep tendon reflex, for instance, at the knee or in other locations, like at your elbow, for instance. I generally don't see changes in that with Bartonella. Could it happen? Yeah, it could happen. Let's see. Regarding the rash that people get with Bartonella, one of the rashes they get are these rashes that can look like scratch marks or stretch marks. I'm not sure what you mean specifically by claw marks. Let me describe why they happen. So with Bartonella, Bartonella likes to burrow into tissues, and it releases enzymes that help it do that. And those enzymes can break down what is known as connective tissue. That's the tissue that holds things together, okay? That's the tissue that holds your skin cells together, for instance. And so if that connective tissue gets broken down, it causes weakness underneath the skin cells, and that can look like stretch marks, or we sometimes call those stria, for instance, okay? They usually are going to be somewhat lengthy, about that kind of long, maybe a little bit longer. Sometimes they have a red color. Sometimes they have skin color to them. They can come and go. Often, though, once they're there, they're often going to stay. And even with treatment, they usually are not fully reversible in most people. Okay. When I'm treating somebody that gets these stretch marks or these stria this way, I want to make sure that I'm treating them so that I treat them long enough that they don't come up anymore. But I'm not always successful at getting them to go away because some of that injury may just be permanent injury. Okay. Right. And then let's see, shin bone pain. So it's interesting. Bartonella sometimes can give deep bone pain, like you feel it deep in your bones. And one of the areas that you can sometimes feel it is in the shin. I honestly don't understand the mechanism as to why that happens, okay, other than to identify that it is something that does happen. Okay. All right. Thanks for those questions, JT, and good luck to you. Hello, Ruth. Let's see. Is there any evidence that there is Lyme in one's saliva? I have a 2-year-old and I feel paranoid about letting her drink from same water bottle as me, for example. I honestly don't know. I haven't seen the science on that. We generally do not, or not generally, we don't consider Lyme to be transmitted through saliva, though. For instance, if you've got somebody that has Lyme and they kiss somebody, we don't see that it's transmitted that way. We don't see it transmitted by the sharing of kitchen utensils or toothbrushes or anything like that. Even if it is in the saliva, if by the time it got down to the stomach, which you would swallow it down, it would be destroyed by the acid down there. Okay. So it's not recognized that saliva is a way that it is transmitted. I honestly don't know from my review of the science as to whether it is in the saliva or not. Okay. All right. Thanks for that question, Ruth. And let's see, Ms. E. Ms. E, who happens to believe to be a friend of mine, sends greetings. So hello, Ms. E. Thank you for those greetings. All right, let's see here. Hello, Lindsay. Let's see, how would someone know if they have Lyme without a diagnosis? So, Lindsay, I think what you're trying to say is, could their symptoms be from Lyme disease? All right. So, trying to figure out the best way to answer this. So, when we diagnose Lyme, there's 4 things that we consider. Okay. One of those is, does a person have a history of a tick bite, or could they have been bitten by a tick? Okay, and gotten Lyme. So, for instance, hunters, they're at risk. People that hunt deer, for instance, people that actually have a tick bite, they're at risk that it could have gotten transmitted. Or if people live in areas where they happen to have a lot of Lyme, that increases your chances of running into a tick. Okay. Now, keep in mind, 50% of the time that somebody has Lyme, they don't remember a tick bite. That complicates it. Okay. So we consider, number 1, is there a risk of getting it? Number 2, we consider, does a person have enough symptoms that look like Lyme? All right. And probably one of the best ways to see if you're a person that has symptoms that look like Lyme would be to look on the internet and type in Horowitz, Dr. Horowitz Lyme questionnaire. All right. Or he calls it his MSIDS questionnaire. And it's a tool you can use that he's developed, and actually has been able to show some research that it actually can fairly accurately indicate who might have Lyme and who doesn't. It looks at symptoms and you grade it basically. And if you score high enough on his questionnaire, there's a high probability you have Lyme disease. Okay, so I'd encourage you to take a look at that too. The third thing we consider is, are there any physical exam findings? And often there aren't many. I mean, there aren't any that are specific for Lyme, for instance. So a person can look tired, or you can tell they have obvious cognitive or thinking problems, or they have soreness when you push on them. Those are things that kind of support a Lyme diagnosis, but they don't confirm it. Okay. And then the fourth thing we consider is there a supportive test? Is there some testing that says, yep, Lyme is part of this here, okay? Now keep in mind, testing can be wrong. You can have false positives and false negatives. But if you do get a positive test and you have a lot of symptoms of Lyme, probably means you got Lyme disease, okay? All right. So the predictive value of a test, the chances that a positive test are correct increase with the more symptoms you have, suggesting the illness, basically, okay? All right. So anyhow, those are some things I would consider. I'm going to do a quick screen share here because I will show you, I have a very detailed 15-minute video that even lists out all the symptoms that you could take a look at, which is even has more detail than what I just said here, okay? So I can do a quick screen share here. Oops, can't do that. Hold on a minute. I just realized I forgot to set up my computer to do that. Hold on a minute. I got to do something behind the scenes here. All right, let me go back here and try to do that screen share again. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. And for most questions you have, I have written something about it, okay? And you can find what I've written here in this online Lyme guide. I've tried to organize it by various topics, okay? So take a look at this section called How to Diagnose. And then click on this article called How to Diagnose Chronic Lyme Disease More Than a Test. And in here is a pretty detailed video article I have about how you can diagnose Lyme. And it walks through what the symptoms look like and even talks about the Horowitz MSIDS questionnaire, okay? All right. Good luck to you, Lindsay. Hello, and let's see. How serious is a homocysteine level of 16.7? B12 was low normal. Folate has not been checked. I'd like to understand how to lower the homocysteine. Let me check something here. I think you're at the upper, you're either slightly increased or at the upper end of normal. Hold on a minute. I have to look something up. All right. Trying to figure out what the normal range is. Let's see. Homocysteine, normal levels. Okay. Yeah, so I was wondering if you might be on the edge there. So under 15, so under 15 is considered to be normal. Over 15 is elevated, okay? So let's talk about homocysteine. So there is a type of detoxification problem, which is called MTHFR. That stands for methytetrahydrofolate reductase, okay? So that's an enzyme. And that enzyme is used to convert folate from our diet into an activated form of folate, which is called 5-tetramethylhydrofolate, all right? fancy names. But basically, you need to take diet folate and convert it into activated folate as the first step in a number of detoxification chemical reactions, which are called the methylation detoxification pathway. It's like the first step, okay? And if that enzyme, that methyl-tetrahydrofolate reductase enzyme, is not structured correctly, it may make it so that you don't produce enough of the activated folate, that 5-methyl-tetrahydrofolate. And if you don't make enough activated folate, downstream, a lot of the chemical reactions that are supposed to help detox, ultimately leading to the production of something called glutathione, those chemical reactions don't take place correctly, okay? So it used to be, many of us were doing, and some providers still do it, we were doing genetic testing to see if you have a genetic defect that could cause the MTHFR problem I was just telling you about, all right? So we would look to see, do you have what are called genetic SNPs that would possibly lead to that enzyme turning out incorrect in how it operated. And so there's a SNP called the C677 T gene. There's another one called the A1298C gene. And if you had some defects in those, it could indicate that the enzyme would turn out abnormal, and therefore you would not get enough production of diet folate into the activated folate. But we now know more and more about a lot of these SNPs, and that even though we may have a genetic setup that tells us we could have a problem, it may be that we never develop the problem. And that is because our genes also are influenced, and the outcome of what happens at the genetic level is influenced by our environment, okay? And it just so happens that we have a lot of bacteria living in our intestines and viruses and parasites that can sometimes make up for the problems of what is happening with our genetic programming. So what I've started doing more and more, and many of us these days are moving away from doing the MTHFR testing, SNP testing, genetic testing. And rather what we're doing is we're looking to see, is there any proof that the detoxification exists, all right? And so what happens is this homocysteine level will become elevated if there's not enough diet folate turned into the activated folate, okay? And so what the treatment is to take the activated folate. And if you do that, that will cause the homocysteine levels to come down, okay? And it will lead to better detoxification. And so usually the way I'm going to treat this is to use both the methylated folate that I've talked about as well as methylated B12. They both can help. And the product I like using is a Thorne product called MethylGuard. And I usually try to work up to having a person take 3 of them 1 time a day. Keep in mind, as you start correcting for abnormal detoxification, that's going to open up the floodgate of toxins that have kind of built up. And when you start then suddenly detoxing these toxins, it can lead to a surge in inflammation chemicals called cytokines. So we usually don't want to open up too quickly. All right. So the way that we use this MethylGuard that I was just telling you about is you start at 1 pill a day for about 7 days. And if you haven't flared up, then you go to 2 pills a day. And again, if you haven't flared up again, then you go up to 3 pills 1 time a day. Okay. So yeah, I would go ahead and treat that situation that you have, especially with the homocysteine above 15. Okay. All right. Thanks for that question, Ann, and good luck to you. So I've actually recently updated the article that I've written about MTHFR. And I'm going to go ahead and do a screen share so I can show that to you. So if you want more detail, take a look here. Let's see, I'm just going to look at my latest articles. All right. And here you'll find the article on MTHFR here. Okay. So it has further detailed explanation about what I was just talking with you about. And while we're here, I just want to let you know I republished, redrafted, rewrote in a big way my article on brain fog and Lyme disease, what you can do. I just released that today. So that's my latest new article as well too. Okay. All right. All right. Thank you for that question. Hello, Tammy. Let's see. Can you mix Biocide and LSF in water with herbal tinctures and take them all at the same time? Is it okay to take them at the same time as antibiotics, supplements, or food? What non-soil-based probiotic, prebiotic, and Saccharomyces Boulardi do you recommend? Okay. All right. So let me see. The Biocide and LSF. So Biocide and LSF is this product called Biocide, and there's different formulations of it. There's Biocide in liquid drops, there's Biocide in capsules, and then there's Biocide in LSF. LSF means it's microscopically wrapped in fat, okay? The trouble is with fat and water is fat and water don't mix together, okay? So even if you put it in the water, it's going to wind up floating. You're not going to be technically mixing it with the other herbs. Can you do that? And can you take other herbs at the same time? Absolutely. But just be aware they're not going to all mix together because the fat is going to float basically. All right. Let's see here. Is it okay to take them at the same time as antibiotic supplements or food? The answer is yes. And then what non-soil-based probiotic, prebiotic, and Saccharomyces Boulardi do you recommend? Okay, so the Saccharomyces Boulardi, everyone, is a healthy yeast that lives in our intestines, and it supports good function, okay? Good absorption, good all kinds of function aspects. And so I like a thorn product called Saccharomyces B. All right. So SACRO and then the letter B. All right. Terms of probiotic, the soil-based probiotic I prefer is a product made by research nutritionals called Corebiotic, and it has a prebiotic fiber included in it. So to answer the second part of your question, I usually try to use my probiotics that have prebiotics in them. Okay. All right. So there you go. That's the response. So good luck to you, Tammy. Thanks for that question. Hello, Doug. Let's see. Hi, Dr. Ross. Thank you for everything you do for the Lyme community. You're welcome. Can you describe treatments for the leak and leaky gut, as well as motility issues in the intestines? Thank you. So in terms of leaky gut, and then I'll talk about motility. So in terms of leaky gut, let me describe what we mean by that first, okay? So in terms of what your gut anatomy is, you have the inside of the intestines, and then you have one layer of cells, literally just one layer of cells, and below that layer of cells, you have blood vessels that run, okay? Now these cells that separate the inside, your poop, from getting into the bloodstream, these cells, there's only one layer. And they touch together so there's no gaps, okay? Now, the way that nutrients and things that we want to get into our bloodstream get into the bloodstream is they get absorbed into these cells, they pass through the cell, and then they go into the blood vessels down here, okay? Now, there's another part of the structure here too. So you got poop, cells, blood vessels. In between these cells and the blood vessels is 60 to 70% of your body's immune cells sit right underneath this single layer of cells that separates your inside of your intestines from your bloodstream, okay? And they provide a barrier, a kind of another layer of protection from things getting through. Now, the way that things get from here to here is they have to be microscopically digested by enzymes and by acid, and ultimately by the good, healthy bacteria that live in the intestines. They take what are very microscopic amounts of corn or potatoes or wheat, and they digest them down into their individual parts, like amino acids and like fatty acids and like sugar, okay? They make it so that those amino acids, fats, and sugars are not recognized as being corn or being a potato or being wheat, for instance, all right? That's if the intestines are functioning well, all right? Now, if you get an infection on top of these cells, like yeast is a big one, for instance, yeast overgrowth, these cells will plump up, swell up, and pull apart. And now you got gaps. And so instead of having this be a nice barrier that only allows microscopically digested food particles through, and keeps toxins out and keeps germs out, etc. Now you got these gaps through which partially digested food gets through and toxins get through. And those things all wind up hitting all these immune cells down here. And guess what they do? Well, they trigger immune reactions. And the immune reactions that they trigger are those white blood cells can manufacture cytokines. Many of you know from my discussions about Lyme disease, the reason you feel bad in Lyme is your immune system manufactures too many cytokines. So if you've got leaky gut, that may be making your Lyme look worse. All right, too many cytokines give you fatigue, make you hurt all over, make your brain not function correctly, disturb your sleep. So that's why I say that this is basically Lyme symptoms, right? Okay. The other thing that happens though, when these the other type of immune cells that get stimulated though are also called mast cells, and those mast cells release histamines. All right. So if you've got these gaps, one of the things you'll start seeing is food allergies develop because you're getting microscopic amounts of corn that get through that are recognized as corn, and then you start reacting to corn each time that you have it. All right. So the solution for leaky gut is heal these gaps. And the first step is get rid of the infections that are leading to the swelling and inflammation. Okay. So that means making sure that you don't have yeast. And if you do, treat for yeast. That also means making sure that that if you have a high risk of picking up parasites in a foreign country, or if you're a person that's drank from well water that could have parasites that were not showing up when your wellhead was tested, it means you got to get rid of those infections too. Now, often and then remove anything temporarily. Do an elimination diet where you remove things that might be triggering allergies that are leaking through. Okay. Right. Those are the basic steps that I do. Now, I'll do that and I'll get the yeast out, I'll get the parasites out. And usually within about 2 to 6 months, the leaky gut will go away completely. And often that's all you need to do. But if you want to add some other things that will help lead to a quicker healing of those cells, the one thing I like to use is something called L-glutamine powder. Glutamine is the food source for those cells that line the large intestines especially. And you would want to do a total of about 12 grams a day. It comes as a powder. And usually, depending on the manufacturer, I think I'm using a Thorn product right now, actually, as my L-glutamine. But of the Thorn product, you would wind up, for instance, using a scoop of it 3 times a day. Okay, so you can do that. So get rid of your infections, be on some type of elimination diet, and then you can use L-glutamine. Other things that can help lead to quicker healing is to decrease some of that inflammation, and that can be to use vitamin D3. 5,000 international units one time a day can be helpful. The other thing that can sometimes be helpful to decrease that inflammation, in addition to being on healthy probiotics, is to be on Saccharomyces B that we just talked about, 2 pills one time a day. If I've got a person that has, as part of their leaky gut, a lot of gassiness and bloating, I might also use digestive enzymes like an integrative therapeutic similase, for instance. I might do that to aid in some of the digestion too. Okay, so there's some thoughts. All right, now motility, and I think what you mean by motility is motility issues often mean a person is constipated. They're not having regular bowel movements. Okay, their intestines are not moving things through quickly enough as they're supposed to. One of the stimulants that I like to use for that purposes is magnesium. Magnesium can be a very useful stimulant that gets the intestines working correctly. And I usually will use somewhere up to 600, maybe even 1,200 milligrams a day. I will do 600 milligrams at night of either magnesium citrate or magnesium sulfate. And if that's not loosening up stools and getting good enough bowel movements, then I might go to 600 milligrams twice a day. Okay. If you're using too much magnesium, keep in mind it might lead to leaky gut. I'm sorry, to diarrhea, not leaky gut. Might lead to diarrhea. Okay. All right. So those are my thoughts for you. Okay. Lastly, the other thing that can be really useful for increasing motility is fiber, any kind of fiber foods. That means whole fruit, whole vegetables. And I did not say vegetable juice, and I did not say fruit juice. I said whole fruit, and I said whole vegetables. Okay. All right. The fiber in there can stimulate your intestines. Beans, legumes, and grains can stimulate your intestines. Sweet potatoes, rich in fiber that can stimulate the intestines. I would not recommend white potato because there isn't much fiber there that's that useful. Okay. All right. I hope that answers your question. Good luck to you, Doug. Let me do a quick screen share here. Okay, so I mentioned the possibility of looking for yeast and parasite infections. In terms of how do you figure that out, in terms of diagnosing yeast, take a look at my how to diagnose section. Again, the way I just found that is I went to the big menu on my online Lyme guide, and I looked at my how to diagnose tab here, okay? All right, and so down here is an article that I've written about how do you diagnose yeast, and most of it's based on clinical symptoms, all right? And then there should be an article here about how to diagnose parasites, or how do I diagnose parasites? I didn't include it here. I need to relabel it, I believe. Take a look at here. Take a look at my article on parasites. So this is how I treat them, but also in how do you diagnose them, as I talk about that here in this article as well too, okay? And then finally, I do believe I have an article on leaky gut. Let's look at our stomach and intestines section here. Yeah, here's an article, a video that I've created on leaky gut syndrome. You can find it there. Okay. All right. Good luck to you, Doug. Thanks for the question. Hello, Alex. Let's see. Hi, Dr. Ross. My wife and I have been sick with 3 Bs for 3 years. I think what you mean by the 3 Bs is Bartonella, Babesia, Borrelia being Lyme. We have been treating for 2 years and a half, and unfortunately, we never reached remission, always staying on 65 and 80%. We had this dream of trying to conceive a baby next summer. Do you think it's something reasonable despite not being in remission? If yes, what would be the recommended protocol of antibiotics for both of us while we try to conceive? So until you can conceive, and I'm speaking, let me talk more about what is safe to do from the maternal standpoint, okay? So the one thing we get concerned about with a mother having active Lyme and getting pregnant is that there is the possibility that the baby could get the Lyme from you, okay? And that's because there is mixing of blood in the placenta, and so there's the possibility, there's a risk that Lyme could spread during pregnancy. Now, I'll tell you, the science is not the greatest here, okay? What we do know outside of research studies, though, is there has been pregnancy registry data where women allowed information to be collected about them that had Lyme back in the late 80s and early 90s in Connecticut, I believe, the East Coast, I believe it was Connecticut. And what the database showed is that if a woman had active Lyme or Lyme and active Lyme, that if she was on an antibiotic that was safe to the baby, that there would not be transmission to the baby. But if she was not on an antibiotic, there seemed to be a 50% transmission rate. Okay. So most of us kind of use that as a guide to say, maybe we should try to do things to prevent a baby from getting it. Okay. Now, so one thing to consider is, when do you need to get on an antibiotic that might prevent transmission? Okay. Second thing that I'll just point out to you is, generally, when a woman has active Lyme and she has symptoms, when she gets pregnant, often she feels a lot better. And the reason we think that happens is there's some animal studies that suggest that inflammation in the body in general decreases during the hormonal environment created for pregnancy. All right. So your body wants to do everything to protect that growing baby, and it tends to decrease the amount of inflammation that's there too. That's why women can feel better. But often after the delivery, when a woman becomes more sleep deprived and under the demands of pregnancy and the loss of some of those hormones that seem to keep inflammation down, often a woman with Lyme will tend to get a little bit worse after pregnancy. Okay. So in my practice, what I do is I basically change the antibiotics to one that we can use safely during pregnancy to prevent transmission after there is conception. All right. And you have time. So if you have up to about 2 weeks after your first missed period before there is decent blood flow to the baby, basically, the developing baby. And so you could miss your period and even have up to 2 weeks after that first missed period to change your antibiotics to one that is safe to take in pregnancy. And the ones that are safe to take during pregnancy are cefuroxime, something called cefdinir, and something called azithromycin. Okay. You could also do amoxicillin. And I write about that in the article that I have about Lyme and pregnancy. Okay. So those are my thoughts. I don't think that as the husband, I don't think there's anything you specifically need to do that is different going into the pregnancy. Okay. But, and even as a female, I think you can keep treating all of your germs and using your full antibiotic protocol and supplements until you get pregnant, and up to 2 weeks after that conception occurs, which I'm sorry, up to 2 weeks after your first missed period, I should put it that way. Okay. All right. Thanks for that question. Let me do a quick screen share here. All right. So take a look. I have a section on pregnancy. And take a look at this section I have on Lyme and pregnancy. Will my baby get it? What about my health? And I talk about the different antibiotics, what to do, etc. Okay. Good luck to you, two of you. Hello, Tammy. Oh, let's see. Does your protocol for Bartonella apply to adolescents with PANS triggered by Babesia, Bartonella, and mycoplasma? So in terms of Bartonella, the antibiotics that I recommend for Bartonella will also treat mycoplasma. All right. In terms of them treating Babesia, no. Babesia requires a different treatment. So if somebody has Babesia, they need to be on antimalarial agents, not the kind of antibiotics that I typically recommend in my Bartonella treatment protocol. Okay. So let me show you the two articles where you can take a look at what those ideas are that I have for treating both Babesia and Bartonella. All right, so take a look at my infection treatment plans section here. And then take a look at my Bartonella guide and my Babesia guide. By the way, this Bartonella I updated, I think about over a month ago now. I think about a month ago, but it's very current. It has more new information in here about how do you deal with persister forms of Bartonella and Bartonella biofilms. Okay. All right. Good luck to you, Tammy. Hello, Zachary. Let's see. Does a functional medicine doctor have what it takes to treat chronic Lyme? It depends on the functional medicine doctor. It depends if they've gone and gotten further training to manage Lyme disease. So it's very interesting. So the group that the National Lyme Disease Group is a group called the International Lyme and Associated Diseases Society. At one time, it was a group of doctors that predominantly were only very knowledgeable about how to use prescription antibiotics to treat Lyme and co-infections, but they really didn't have training or adequate knowledge about all the other functional medicine type supports and integrated medicine type supports that you can use. Over the years, that group has slowly changed, and many of the doctors that are trained by that group to manage Lyme disease now also have gained experience in various aspects of integrative medicine and functional medicine. So what I would suggest is ask your functional medicine doctor if they've received any training through ILADS. Have they gone to the conferences? Have they done the basic workshops on how you manage Lyme disease? And if they have, you're probably in good hands. If they have not, I would consider getting somebody that has some experience working through ILADS, okay? All right. So that ILADS, the International Lyme Associated Diseases Society, their website is at ilads.org. You could go to their website on the contact page. They have a section you can fill out to help them identify doctors in your area that are members of ILADS. And so that's a starting point to consider too. Okay. All right. Good luck to you, Zachary. Hello, Gail. Let's see. Hi, Dr. Ross. 3 questions. Is it possible to get too much glutathione if you use the Trifortified daily? In terms, can you be harmed by it? No. In theory, could you start getting more than you need? Is possible. Is possible, but it's not gonna hurt you. Let's see. Is there a way to test levels? And if so, how and do you recommend? So in theory, I believe there are some companies that measure glutathione, but I'm not familiar with using the testing. So I'm not going to be able to respond to that part of the question. Number 2, I've been alternating Claritin and Allegra to see if maybe I have mast cell activation syndrome. It's been a week plus I've taken at bedtime alternating nights. Are the risk of taking these daily long term? Can you get a flooding of histamine when you stop taking them? If so, how long would one need to be on them to see a surge of histamine when they stop taking them? So I am not aware of histamine surges that happen when somebody comes off of one of those medications. It's not reported in the literature. I haven't seen any research, or am I aware of any research that says that that happens. Okay. So I don't think that is what would happen. Let's see. And it is safe to stop your antihistamines cold turkey. Let's see. Should bentonite clay be taken away from food? So bentonite clay, bentonite clay is used to bind toxins. It's a binder. So my recommendations about timing of bentonite clay is to stop all your medicines and supplements at least a half an hour before you take it, and you can resume your medicines and supplements 2 hours after you take it. Regarding food, you can actually have food anytime, but the ideal time to have it is about half an hour after you take the bentonite clay if you have a gallbladder. And the reason that's the ideal time is when your liver moves toxins, whether it's processed them correctly or not, after they go to the liver, toxins get stored in the gallbladder. When you eat, the gallbladder contracts. It triggers the gallbladder to contract, squeezing those toxins stored in it out into the intestines, okay? And so the reason you want to the ideal time to eat is a half hour after you take the bentonite clay, is by the time when you take the bentonite clay, after about half an hour, it has worked its way into the area of the small intestines where the liver, through the gallbladder, releases those toxins, okay? But it takes about half an hour to get there, okay? All right. Gail, thanks for that question, or all those questions, I should say. Hello, Mizzy. Let's see. What are your thoughts on GI map testing and leaky gut as it relates to Lyme and or mold? Also, what is the meaning and nature of a high zonulin? So zonulin is a protein that is found in these gaps, okay? And when we say high zonulin, what we're actually measuring is, have you developed antibodies against that zonulin? If it is elevated, that suggests that you have leaky gut going on, okay? It can suggest it. Now, it's not fully clear yet whether that's a fully accurate test or not, okay? In terms of GI map testing, if you're referring to the specific test called the GI map, one of the things that testing does is it looks to see, and I haven't actually ordered that specific test. I use different testing, but I believe the GI map testing, and when I've seen people that have brought that into me, primarily indicates bacteria and the bacteria makeup of your intestines. It may also tell us more, but let me talk about this in a different way. So I guess I'm not clear yet what the actual GI map does because I don't use it, okay? But what I like to do is to get a GI. Sometimes if I'm really stumped on what is happening in the intestines, what I will do is get a GI profile and or a GI analysis, stool analysis. And I like using either Great Plains Lab or Genova Diagnostics. And what both of those labs do with their comprehensive GI analysis is they look to see what kind of balance of good bacteria and bad bacteria and parasites and yeast you have, okay? So they give us a profile. They also look at chemicals that are made by the pancreas that help us understand whether the pancreas is working well enough to aid in digestion or not, okay? So for instance, one of the chemicals they measure is something called a pancreas elastase. If the elastase is low, it means your pancreas isn't working well enough. It's not receiving signals from good bacteria in your gut to make enzymes, and therefore you're going to have poor digestion because of that, okay? One of the other things we can get from a comprehensive GI analysis is measurement of a chemical called calprotectin that can be elevated if you have a lot of inflammation. And specifically, it can be elevated if you have inflammation like that caused by something called ulcerative colitis or something called Crohn's disease. So if that comes back elevated, it means you may have an arthritic condition of your gut called ulcerative colitis or Crohn's. And that is a situation where you would want to actually be scoped, doing colonoscopy, where they put a tube in and look from below at your intestines. You would want to be scoped by a GI doctor to make sure you don't have ulcerative colitis or Crohn's disease, okay? All right. Finally, the other thing that you can find on a comprehensive GI analysis is something called a beta-glucuronidase. And beta-glucuronidase is an enzyme that if it's elevated, suggests that you don't have enough good bacteria in your intestines. It's used by dysbiotic bacteria to cleave off, break off chemicals added by your liver to make toxins water soluble. The beta-glucuronidase will break that stuff off, making it so all that good detox work that your liver did gets ruined, and you have increased toxins going on within your intestines. Okay, all right. So I'm sorry, I just don't use the GI map testing, so I'm not remembering specifically what's in it. But what I do like doing is doing in situations where I try to treat for leaky gut, and if I'm not getting far enough along, I might want to do a comprehensive GI analysis either through Great Plains Lab or Greater Smokies Lab. Okay, all right. Thanks for that question. Hello, Patsy. Let's see. Hi, Dr. Ross. My question is about minocycline and vertigo versus a Herx reaction. My husband has Lyme and Bartonella. He has been on disulfiram 1 year, currently at 156 milligrams daily, methylene blue since March, a low dose naltrexone since May, minocycline since June. He experienced mild nausea and dizziness since June. In July, he increased minocycline to 2 times a day. 2 weeks later, he had constant nausea and dizziness that could not resolve. A week later, he stopped minocycline. The vertigo continues now, 5 days later. Blood work is normal. He is also taking turmeric, glutathione, NAC, alpha-lipoic acid, vitamins, fish oil, probiotics, and more. Do you think minocycline is causing the vertigo even 5 days after stopping it, or is this a Herxheimer reaction? If someone is intolerant of minocycline, would they be tolerant of doxycycline? Thank you very much for your help. So minocycline, everyone, is a tetracycline, and the doxycycline that Patsy asked questions about is a tetracycline too, okay? The key difference between minocycline and doxycycline is that minocycline is extremely fat soluble. And because it is fat soluble, it may more easily cross over into the brain. I will tell you though, doxycycline's got good brain penetration though too, okay? And so, all right, so that one of the things that can happen because it is so fat soluble, when minocycline crosses over into the brain, it also sometimes can concentrate in very large amounts in the fat coverings of our nerves. And there, when it concentrates in those fat coverings of the nerves, it can become an irritant. And one of the things that can lead to is vertigo and dizziness, okay? So probably it is from the minocycline. The problem is once the minocycline is in the fat, things that are in the fat can take a while to get back out. And so just stopping your minocycline after 5 days, he still has got minocycline in his fat surrounding the nerves that's irritating them, okay? It can sometimes take 2 weeks to a month to get all that minocycline out. At least that's what my experience is, okay? So I'd suggest giving it more time. One other note I should make too, the other key difference between minocycline and doxycycline is minocycline, people tend not to sunburn as easily as they do on doxycycline, okay? All right. So I would consider looking at doxycycline. You're probably still going to have adequate brain penetration with it. This does not sound like a Herx to me. This sounds more like side effect of minocycline irritating those nerves, okay? All right. Thanks for that question, Patsy. Hello, Ms. E. Let's see. I actually think you're a different Ms. E than I thought you were. Anyhow, so let's see here. Judging by your questions that you're asking, okay? So Lyme test results, an IgG of 18 antibody. I guess that means your band 18 was positive. What is this? What does it mean when testing results states it is present abnormal? However, all other markers are absent. Thank you. So when you get back a Lyme disease test result and you see these numbers, like a P18, we call those bands, okay? And what those are that is how we identify different proteins that can be found on the covering of the germ. We identify them by what they weigh. So there is a protein, of which there's multiple copies, found on the covering of the Lyme germ that weighs 18 kilodaltons. And what this test indicates is that your immune system is making a type of antibody called IgG antibodies that are attaching to that protein that weighs 18 kilodaltons, okay? All right. Now, the problem is with that 18 protein is that there is a chance that if you've had chronic virus infections in you, like Epstein-Barr, human herpes virus type 6, for instance, that sometimes the antibodies we make against those viruses may cross-react to the 18 antibody. So having antibodies that are showing up on your Lyme test attached to the IgG for protein, IgG antibodies stuck on protein 18 does not necessarily mean Lyme. It could be that you had some virus in you that triggered those antibodies to be made to attach to that Lyme protein, okay? So to get around that problem, we want to see more antibodies against what we call Lyme-specific proteins. Lyme-specific proteins are ones for which most often the antibodies that get stuck on them are actually made against Lyme and not another infection. And those Lyme-specific antibodies are protein 23-25, or we call that band 2325, protein 31, protein 34, protein 41, and protein 83-93. And the odds that you have Lyme are increased if you have antibodies against two of those, okay? All right. Thanks for that question. Let's see, Peter, my 23-year-old daughter is recovering or is receiving IVIG drips for her Lyme disease. And I wonder what you thought of this treatment and your experience with its success. So IVIG stands for intravenous immunoglobulins. And so these are antibodies that she's receiving, okay? Where they come from is they're made by pooling together donated antibodies from multiple people. And the trouble that they could lead to is, although they are screened for infections, it is possible that your daughter could be getting infections from that, okay? The other problem with IVIG is that sometimes we have our immune systems react against them as being foreign when they come from somebody else, and we can get temperatures, for instance. And because of that, sometimes doctors, to prevent the autoimmune reaction that can sometimes happen against these foreign antibodies, some doctors will give steroids. And steroids can suppress part of the immune system that fights Lyme, some parts of the immune system that fight Lyme, allowing Lyme to get more active. So if you're going to do IVIG, and I'll tell you why you might want to do it, I just want to make you aware of certain issues. One is there's a risk you may be picking up other stuff. And two, if your daughter is receiving steroids at the time to dampen down the immune reaction that can happen to these, that could be allowing her Lyme to get worse, okay? All right. There are two situations where I think IVIG may be helpful. One is if a person has developed a neuropathy that is what we call small fiber neuropathy. It's nerve injury to the very small nerve fibers. Then IVIG has some track record and some science showing it can repair those nerves. Okay, all right. And but the only way to know if that is the problem is to get a skin biopsy where a pathologist looks under the microscope to see, do you have evidence of small nerve fiber injury. Okay. The other situation where IVIG can be helpful for some people is if they have low Ig antibodies. And so the way you find out if you have low Ig antibodies is to get Ig antibody testing to find out what your Ig antibodies are. And there's different classes of those. If you have a certain lowering of certain kinds of those Ig antibodies, then getting IVIG may improve your immune function too. Okay? All right. So those are just some thoughts on that. Good luck to your daughter. Ms. E says, thank you so much for your time. You're welcome. And good luck to you. See, Tammy, I see, can you, oh, we already answered that one. Got some people that posted their questions twice, so I'm just removing those. This next question is from Pedro. Hello, Pedro. Let's see. Hi, doctor. I've been treating Lyme for a few years. About a month ago, I had to take 7 days of naproxen for a heart pericarditis. Unfortunately, I ended up with acid reflux that is still going on to this day, despite trying proton pump inhibitor for 1 month, omeprazole. Do you think I should ditch such medication and instead go to something like sucralfate? Thank you. So if the omeprazole is going to work by trying to turn down acid production within your stomach. So you're not having as much acid coming up into the food pipe, irritating it. That doesn't always work. In fact, even though people may have this kind of what we call it acid reflux, there's some studies that suggest that not everyone that has what we call heartburn from acid actually has anything to do with the acid going up there, okay? If the lowering of acid is not working, the next step would be to coat your food pipe to protect it from being irritated. Sucralfate, which is a prescription, will do that. Another alternative to that could be to use something called deglycerated licorice. So licorice, yeah, not the candy kind of licorice, but herbal medicinal licorice. If you chew licorice tablets, your spit and saliva interact with the licorice, creating a microscopic gelatinous coat that covers your food pipe and can actually cover the lining of the stomach. That sometimes can be very useful in a situation like this too. If you were to do that, I suggest an integrative therapeutics product called Rhizinate, and you would chew 2 capsules before meals 3 times a day and even before bedtime. Okay, all right. Sucralfate is another option that also is 4 times a day. That's a prescription. It's usually done as 1 gram before meals 3 times a day and before bedtime as well too. Okay, all right. Good luck to you, Pedro. Hello, Zachary. Let's see. Could esophagitis, gastritis, acid reflux be caused by an underlying chronic Lyme infection? You know, I haven't seen in all the years I've been doing this, I've been managing chronic Lyme since 2004. So in all those years, I haven't really seen that chronic Lyme is the cause of acid reflux, okay, or esophagitis. It is. So gastritis, so esophagitis means inflammation of the food pipe. Gastritis means inflammation of the stomach. And then acid reflux means acid from the stomach going up, okay? I guess I would answer, I haven't seen that. I haven't seen that, number one, treating Lyme makes any difference for that. And I haven't seen any science that says it is that way too, okay? All right. Thanks for that question. Hello, Joyce. Let's see. Hi, Dr. Ross. Bitten by tick in 2001, tested positive, and did 3 to 4 weeks of doxy. Told I was good to go. Never realized all symptoms over the years were Lyme related. Severe sinus infection in 2016 and brought everything to a head. Started with minocycline, artemisinin, and plaquenil, then only herbs since then. A few months ago, I started Sida acuta hutania, recently added cat's claw and banderol. Not sure if current symptoms are normal. Hair falling out, blistery rash on the right foot only, severe intermittent sweats throughout the day, random dizziness, severe fatigue. Most of these symptoms started after I added the last 2 herbs. Blood work shows Lyme, Bart, and Babs. Thank you as always. So let's see here. So you've gotten hair falling out, blistery rash, severe intermittent sweats. And the last 2 herbs are Sida acuta hutania. So I haven't seen Sida acuta hutania lead to a blistery rash. Okay. It is possible it's some kind of a severe allergic reaction, but usually I would expect it to be more than just your right foot. Okay. Usually if it's an allergic reaction, I'd expect you to have problems throughout your body, not just in one spot. The fatigue and dizziness and even the sweats could be a killing reaction from adding those 2 in. Yeah, so those are what my thoughts are for you there. Okay, you may want to just give them a little bit more time. Make sure you're taking some things to deal with Herxheimer reaction. The 2 things that I would consider would be to be on liposomal glutathione at a teaspoon 1 time a day. And then you might also want to try the liposomal curcumin that I mentioned. Maybe I didn't mention that, but curcumin, which is a component of turmeric, is very useful at getting inside white blood cells and blocking their production of cytokines. So if you do 500 milligrams as 1 pill 3 times a day, that can help with Herx reactions as well too. Okay. All right. Good luck to you, Joyce. Oh, one other comment I wanted to make. So, that when people get antibiotics after a tick bite for 3 to 4 weeks, data tells us that does work 85% of the time to get rid of Lyme. All right. But it fails 15% of the time. Well, actually 15 to 20% of the time if we look at data about that. So I just want to let you know, even though it's fairly good to get your 3 to 4 weeks of antibiotics after a tick bite, it doesn't work 15 to 20% of the time. Okay. All right. Thanks for the question, Joyce. Let's see here. Hello, Sherry. Just a minute there, everyone. I got a little bit of a dry throat here. Let's see. Hi, Dr. Ross. I have been treating Lyme, Bart, and Babesia for the past 2 years. My worst symptoms are feeling of off balance when I walk and slurred speech. I have followed your tier 1 antibiotic treatment most recently for Babesia the last 6 months, and most of my symptoms have resolved over the past 2 years, but not the off-balanced feeling and slurred speech. Do you think I need to treat a little longer, or could it be mold toxins? Bear with me. I'm just reading back through here again. So the slurred speech and the off-balance, so off-balance can sometimes be part of Babesia, but I would not think of slurred speech as being part of that. Off-balance also can indicate a neurologic problem, and the slurred speech is a neurologic problem as well too. The two things that would have a greater chance of giving those symptoms would be Lyme, causing some neurologic problems, or Bartonella. Okay, so it could be, so mold toxins can sometimes lead to neurologic dysfunction too, but typically with mold toxicity, you're going to have a lot of body pain. You're going to have a lot of fatigue. And from what I understand here, you're describing you're doing a lot better. So I'm not sure. What might be useful here, Sherry, is for me to help give you the best response. You might consider doing one of my, what I call a limited consult service visit, where I could visit with you online, ask you lots of questions, and try to come up with a more specific response to the situation that you have, okay? All right, let me show you how you might do that, or where you can look up more information about that. I'm gonna do a quick screen share here. All right, so this, let me try to get to my practice website. So here on my Lyme information site, if you want to know more about my clinic and my practice, click on the clinic here. It's literally going to pull you over to my practice website, and take a look at this appointments page. And what this does is describes the two kind of visits I offer. I offer a full medical service where I can prescribe and order tests. And I also offer something called a limited consult service. Look all the way down here where I describe what happens in the limited consult service. And I also describe what happens in my full medical service. Be aware in both of these, there are forms you need to fill out, okay? So take a look down there. But read through these sections and see if this is something that might be appropriate for you. And if you do decide to do it, you can book the visit by clicking that Book Now button, okay? All right, thanks for that question, Sherry, and good luck to you. Hello, Brandon. Let's see, do you know of any live microscopy resources in or around Seattle? No, I don't. I'm not aware of who's doing that here. Thanks for the question. Hello, B. Let's see. Are painful muscle spasms common with disulfiram treatment? Can you review your thoughts about addressing the crippling fatigue and brain fog? You know, I haven't, in terms, so disulfiram, everyone, I think you're all familiar with, is the medicine we're now using to treat for persistent Lyme. And it is a drug that has historically been used to treat alcoholism, okay? In terms of whether it can lead to muscle spasms, you know, I haven't seen that occur in the patients that I've been using it on. I'm using a lot of it too, but I haven't seen that occur. And I would not, when I look at the list of known common effects of it, I don't see muscle spasms listed as one of those, okay? All right. In terms of fatigue and brain fog, so many of you, I showed you earlier, I just released earlier this afternoon, well, a couple hours ago, maybe a few hours ago, an article that I've been updating for over the last week and making it more current. And that's the article that I have written on brain fog. And in that article, I describe the various causes of brain fog. And so specifically, brain fog can be caused by inflammation, can be caused by mitochondria dysfunction. Mitochondria are the energy factories found in every one of our cells, but you need to have good energy for your nerve cells to heal, okay? Third thing that can lead to a lot of that brain fog is making too many histamines, like in mast cell activation syndrome or histamines from excessive allergies, okay? All right, now, when we look at the causes of inflammation, there's things that trigger inflammation, and then there's some things you can do specifically that target the inflammation chemicals. So you want to fix the things triggering inflammation. And those things that trigger inflammation could be mold toxins, could be Lyme infection, could be Bartonella, maybe too many yeast living in your intestines, okay? All right, so you want to deal with those problems. In addition, you want to take curcumin to lower inflammation cytokines, all right? Also, as part of treating brain fog, you want to do some work to fix the energy factories called mitochondria, which will also help with some of the crippling fatigue that you have. And so I'd like to do what's known as lipid repair of the covering of mitochondria. So mitochondria, everyone, are the energy factories found in every one of our cells. We estimate 300 to 400 per cell. Oxidizing agents that get made by the immune system trying to get rid of germs can damage the covering of the mitochondria. And if it gets damaged, you're not going to have adequate chemical reactions occurring in the mitochondria to create cell fuel. And you need cell fuel for the nerves to work, and you need cell fuel for the nerves to repair. Okay? All right? So you want to fix that. My favorite thing to use is a product called ATP 360 by Research Nutritionals. You want to do 3 pills 1 time a day of that. That fixes the fat layer, the phospholipid fat layer of the mitochondria. If, however, you're on taking something called atovaquone, which is found in Malarone or Mepron to treat your babesia, you do not want to take ATP 360 because it has coenzyme Q10 in it too. You don't want to mix coenzyme Q10 with those babesia meds. In that case, what you would want to do for phospholipid repair is NT factor, and the NT factor has those phospholipids, but without the CoQ10. And you do that as 2 pills 3 times a day for 2 months, then 1 pill 3 times a day after that. In addition to fixing the mitochondria covering, you want to repair the mitochondria from the inside. And the way that you wind up repairing it from the inside is to use glutathione. And you want to take that Trifortify product I like from Research Nutritionals as a 5 milliliters 1 time a day. Okay. All right. And then see if you're a person that has mast cells, or see if you're a person that has a lot of allergies. If you do, then you might want to take some steps to stabilize the allergy producing cells in the body called mast cells. And you can do that with either something called luteolin, 100 milligrams 3 times a day, or quercetin, 250 milligrams, 2 pills 3 times a day. Okay. All right. So those are my thoughts. I wrote it down in a more extensive article. I did show it to you earlier tonight. You can find it on my latest tab, and it's got a video I recorded earlier that goes with that as well too. Okay. All right. Hello, Tracy. Let's see. Can Lyme or Bartonella affect scarring from acne? My daughter has acne that I would characterize as mild, but it is leaving lots of scars. This didn't happen before she had Lyme and Bart, even though she had acne before the Lyme and Bartonella. Boy, I'm not aware of Lyme or Bartonella or the things that we use to treat them leading to more scarring. I'm not denying that's happening here, but I'm not aware of that happening, nor am I aware why it would be happening. So I'm sorry, I'm not going to have a good response for you tonight on that. Good luck. And Lindsay says, thank you. You're welcome, Lindsay. I think I answered your question earlier tonight. Hello, Shanna. Let's see. Hi. I have chronic low ferritin despite iron supplementation, thinking there might be something stealing my iron. I took artemisinin and developed a high fever on day 4. I took Artemix capsules. This happened both times. I took it and discontinued. Does this lead you to believe it's babesia? What else could it be? I do have confirmed aspergillus and ochratoxin exposure. So having low iron is not a sign of babesia. All right. So anyhow, having low iron is not what I would use to define babesia. Now, it is true, babesia lives in your red blood cells. And in an extreme way, it might cause breakdown of those red blood cells. But if you have normal blood cell numbers and low iron, is probably not coming from the babesia. Okay, that's been what my experience is. You may just be a person that has poor ability to absorb iron, And there are times that we actually have to do IV infusions or muscle injections of iron. Okay. All right. Thanks for the question, Shannon. Good luck to you. Hello, Zachary. Again, let's see. Would canker sores going away with course of doxy be significant? So canker sores are interesting. In medical literature, we still do not fully know why they occur. All right. I know that I observe that sometimes they come on when people have too many yeast in the intestines, and the literature describes that. The literature also says that maybe these are due to bacteria infections for which we haven't identified a decent source. So being on antibiotics like a doxy may take care of that, okay? So, but I don't think it's significant for Lyme. It just may mean that maybe your canker sores have been caused by a bacteria that the doxycycline is taking care of, okay? Good luck to you. Hello, Jen. Let's see. Hi, Dr. Ross. How long do surveillance labs have to be done after discontinuing disulfiram? Thank you. So the disulfiram has a long elimination half-life, meaning it takes time for the stuff to get out of you, okay? And therefore, it could be interfering with the function of your liver, which is why you're doing the surveillance labs for a bit. And so bear with me here. You see me looking down. What I'm looking down at is I'm trying to look up my drug application to find out something I use that looks at drug functions to figure out what is the elimination half-life on disulfiram. I don't remember it off the top of my head. Bear with me here just a minute. Wow. It's interesting that they have not defined what we call the elimination half-life is for disulfiram. All right, so there's no science that says how long it does take to get out. So a half-life, everyone, is the amount of time it takes for half the drug to get out. And typically it takes 4 elimination half-lives for a drug to be completely out, okay? I would say you're probably screened for up to about a month, just how I've been working with the medicine. And after a month, I don't think there's much more utility in doing screening labs beyond that. Okay. All right. Thank you, Jen, for that question. Hello, Crystal. Let's see. Hello. What are your thoughts on pulsing antibiotics for Bartonella and Babesia? I have heard that pulsing antibiotics for Bartonella can be ineffective. My LLMD has prescribed azithromycin twice daily, pulse dose on Monday to Thursday inclusive, none on Friday, Saturday, Sunday. 2, 100 milligrams of macrobid 2 times a day. And 3, 200 milligrams of hydroxychloroquine 2 times a day. 7.5 milliliters of Mepron 2 times a day, and 50 milligrams of methylene blue 2 times a day. Okay, so in terms of pulsing for Bartonella and Babesia, I'm not a supporter of it. And the reason is both of those germs grow back fast. In fact, Bartonella replicates every 24 hours. So in the time period that you are off the antibiotics, those germs could be coming back, okay? Secondly, the idea behind pulsing, and which can be possibly effective in Lyme, is that while you're on an antibiotic, and we know in Lyme this can occur, the longer you're on an antibiotic, some of the Lyme germ spirochetes and some of the Lyme germ cyst will convert into persister forms, which are hibernating forms, okay? And they don't respond to regular antibiotics. And what laboratory experiments tell us is that when we're off the antibiotics, when they're no longer being bathed by those antibiotics, those germs will pop back out of persister forms and go back into a form that the regular antibiotics we use may kill them. Okay, so the reason to pulse is to literally not have any antibiotics around that may keep those germs in persister forms. All right. So Zithromax is like an antibiotic you can't even pulse adequately because Zithromax has a long elimination half-life. That drug is not actually out of your system on the 3 days you're not taking it. It's still in you. It's still bathing the germs. So in terms of it being an antibiotic that's good to pulse, it's not. I mean, it's still in you. You're losing the effect of why you pulse, which is to cause germs to come out of their persister forms, okay? And if you were to, the only reason to pulse possibly is to treat Lyme. But again, I would not do it for Bartonella babesia. And azithromycin is not one you would pulse. It stays in your system. It's still there, even on the days you're not taking it, okay? All right. So anyhow, those are my thoughts for you, Crystal. Good luck to you. All right. So listen, everyone, that's it for me for tonight. I've had a good time visiting with you. I was quite surprised. Sometimes when I do these webinars, I'm very aware of where I am time-wise. I really got into the zone tonight. I suddenly looked up and it was already 5:10 my time, which means we were at this for an hour and 10 minutes. I was quite surprised. It just seemed like we barely started. But I've got other things to do this evening. I've got a couple Basenji dogs here that are waiting to go. And I'm meeting a friend of mine later to do some strength training, actually. So anyhow, I've got to keep up with those obligations. I am going to be creating a recording of tonight's webinar, as I said, and you'll get that tomorrow morning. So watch for that email tomorrow morning. In there, I will have links that you can sign up for the next webinar. It will not be next week. I may do it that first week in September, but I'm still not decided about that. But I'll make up my mind tonight, okay? All right. So I hope you all found this useful. If you do, please share information about these webinars with other people. The more people I can help, that matches my mission to help people, okay? And you can help me in that. You can help me help people, which means you're helping people, all right? So tomorrow, when you get that email about the recording, send it to people. Let them get the information that we're doing here as well, too. And in the future, when you get emails from me about signing up for these, send it out to other people as well, too. I'd appreciate it if you'd help me do that, okay? All right. So good night, everyone. And I look forward to catching up with you when we do these again, sometime in the next 2 to 3 weeks, okay? Good night, everyone.